think we're live. Hello, Sarah Jane from TYPP and Portion Me Perfect in Glasgow. So welcome to the clinic rooms I'm in today. I was just doing some more training on the laser all remotely, which is just amazing what you can do remotely. There's been some advantages out of COVID as well, like with technology, access to courses and CPD and learning that it wouldn't have been as easy to get to. So today I was just doing some more advanced laser training. So that's what I'm on to talk about today, the MLS Multiwave Locked. Basically here. Now, if you have any questions, please, this is pretty casual. I'm just going to go through what this actually is and what kinds of conditions it's indicated for and can help with. And yeah, just go through some different case studies, maybe just take some questions, but just keep it informal. So this is the MLS Multiwave Locked system. It's a laser system. It's not on just now in terms of there's no laser coming through it at the moment. I'll have to put glasses on when I do show you how that works. But effectively, I'm a sports therapist and a podiatrist, so I can use this for various different things. So, for example, for wound healing, so for chronic wounds, so diabetic wounds, really good for from that kind of cell regeneration and basically getting better wound care results. So that's kind of one side of the spectrum, but also from that musculoskeletal, so that MSK conditions. So if you have come in, you maybe get knee pain, hip pain, shoulder pain, foot pain, arthritic type pain, bursitis, essentially anywhere where there's inflammation causing pain, it is excellent for. Essentially some of the kind of the effects of it, so if we think about the biological effects of the laser, are things like it's increasing the stimulation of ATP inside the synthesis of ATP, so that kind of energy, and it basically essentially means that at that cellular level we're basically kicking those cells into action. So it's happening at that kind of cell level. Let me know if you're there. Essentially also releases the fibroblasts, so growth factors. So again, for that promoting tissue healing, fantastic for that. Now, it's also in terms of the tissue itself, so you'll get that essentially like that inflammation reduction. So for some things that we're doing, a lot of the time, so if we're wanting a patient so you're coming into us maybe with some pain, and we need to change that tissue, especially with musculoskeletal conditions. So we need to basically eccentrically load the tissue. So, and that's eccentric loading anyway is painful. And if you're already in pain, your compliance with that's going to be poor, right? Because it hurts. And that's a big barrier for us as clinicians to get you the results that you want, is getting you past that point of pain. And it can be quite scary for you when you're feeling pain and you're like, is that normal? Should I be feeling this? And you generally will stop doing what we've told you to do because you're like, oh, that's actually making it worse, and it feels worse, but actually that's what we need to get that tissue regrowth and reformatting and regenerating. So if we can utilize something like the laser to counteract that pain, it can be massive for allowing you to be able to do the rehabilitation that you need to do. So that's some of that. And it also is fabulous. So say, for example, you've got quite a lot of edema. So say you've had an injury and there's a lot of inflammation. So it's fabulous for kind of flushing out that edema as well. Now, so you're going to basically get a reduction of the inflammatory compound. You're going to get a reduction of edema. You're getting a reduction of muscle spasms. So if you are prone to getting muscle spasms, I've got many patients that do. You're also, in terms of that kind of anti-inflammatory process, with inflammation, pain closely follows, okay? So if we can reduce that inflammation without you systemically having to take naproxens or some other anti-inflammatory, fantastic. Now, speaking from my own personal experience, of having issues with my hip. Pain is a killer. Pain stops you doing the activities that you want to do. It stops you moving. You're fearful of movement. It interrupts your sleep. It just affects your whole life. So if we can help with that inflammatory process and essentially get the pain down, that's a win-win for everybody. So we're going to increase that. We're going to vasodilate. We're going to get more modular activity. We're going to increase that in that kind of pushing that into the limb system. So we're going to get those, also that inhibition of the pro-inflammatory molecules. So if you're thinking about that kind of cell mechanism that essentially happens inside your body that's promoting that inflammation, we're going to get inhibition of that by using the laser. So it's going to essentially stop that inflammation that's happening. But also the biostimulating effect of the laser. Now, this is amazing for wound healing. So for us, if we're dealing if I'm doing nail surgery, I can see the patient back a number of times within their package, so they're not paying extra for the laser, and I can help with that wound healing. And that's if we're doing surgery on you and you've got an open wound, it's a pain for you. You're having to keep it dressed. Usually, if we're phenolizing that wound as well, it can take about 8 to 12 weeks, depending on your age and your own health circumstances. It can be quite a lengthy time, a good few months. But if we can speed that process up, and I don't say that lightly, that's not something I would say lightly. So that kind of activation, that kind of better supply of your nutrients, oxygen, growth factors, vasodilation. So really encouraging that, promoting healing. So creating that perfect environment for your body to heal that tissue, activation of your cellular function. It's just, I'm super excited by the results that other podiatrists, physical therapists, osteopaths, sports therapists are seeing from it, and bringing that into the Glasgow clinic. So it's not it doesn't look very complex. So that there's essentially in this machine. So generally what will happen, so if I show you how it works, right, so that's just some of the kind of mechanisms of action of what's happening at that cellular level. Hopefully I'm not kind of blowing your mind with that. But essentially, if somebody was coming in to me, for example, say they had plantar fasciopathy, there's many different ways I could treat that. Now, I need to first diagnose. So no matter what you were coming in to see us for here in Glasgow, we would need to thoroughly assess you to give you an accurate diagnosis, to then come up with a treatment plan that gave you the outcome that was, one, realistic, timely, and within your expectations, and something that can be delivered in that period of time. And usually within that, it would be very unusual if we didn't have some sort of rehabilitation within your programme, especially with something that's musculoskeletally indicated. It's going to have to involve some sort of rehabilitation. So this isn't like a magic wand that just, I'll wave this magic wand at you of laser and it will take away all your pain and fix the problem. That thing doesn't exist in anything. There's no cracking your back or mobilising or sticking a needle in or waving a magic laser to make something better. But what there is the utilise of these tools to help us get possibly faster outcomes and better outcomes for you. So for example, if you were coming in and you had quite acute plantar fasciitis, so you had inflammation in that area, usually when patients have that sort of presentation, the pain is usually around the heel. And when you've got something like that, it's extremely debilitating because you're unable to just do normal daily tasks. See, when your feet are sore, when your heel's sore, it affects how you walk, it affects then your ankles, your knees, your hips, your lower back. You ambulate differently, you offload the tissue, you then get usually overstrain injuries elsewhere in your body that just leads to a multitude of problems long term. So if we can mitigate that pain pretty much instantly with this, which is interesting. Now, that's not to say that we just use the laser and you do nothing else, because like full disclosure, you will be doing rehab with any program you do. That would be the case in any physical therapist, physio, osteopath, podiatrist. that you're seeing, you'll be doing rehab, because primarily the reason that you're getting that pain output is because that tissue is not strong enough. And anything we do, anything we're doing, whether it be dry needling, whether it be cupping, whether it be laser, whether it be shockwave, as a modality that helps, but it isn't like a magic wand. So there's always going to be a degree of rehabilitation, and that this will help us allow you to rehabilitate. So if I stick my goggles on, because when we're doing this, this is sending out infrared light that can damage the retina. So if you were in getting a treatment and we were starting a treatment protocol with you, you'd be wearing goggles as well. It's okay because you're obviously watching on screen. The rays are not going to come through the screen and harm you. But certainly for me now, the rays aren't detectable via the naked eye. It will just kind of look red here for me. You might see a little bit of white where you can see the infrared light coming through. I personally won't see that from this side, but on screen it will look slightly different for you. So pop these on. Now, I'll kind of just do my foot to show you. Now, I would have done obviously a thorough assessment, and while I'm doing these sorts of treatments, what I'd be doing is putting in the right protocol, setting this up. We're just going to go to the scan phase. And it's going to beep to tell me, warning me that there's laser coming, and this is the hand piece, okay? So if I pop my foot up, can you all see it? Can't see my foot. There we are. So essentially, usually with plantar fasciopathy and fasciitis, the absolute pain point is usually on this area here, the tuberosity of the calcaneus. So when I'm treating this, I wouldn't just be treating the point of pain, right? There would be a multitude of things that I'd be doing. I'd probably be doing some soft tissue work, trigger point release into gastrocnemius soleus, releasing some of the fascia and trigger point areas and that, because there's we've also got to consider that there's referral pain from this as well. We'd obviously be assessing why you're getting that plantar fasciopathy in the first place and deal with that, because we need to rectify that, or it's just going to come back. Things like footwear, weight loss, if that's indicated, function, gait, all of that stuff all needs to be considered. So in your treatment, what we would generally start with is a scan phase. Now we would do this on skin. Obviously, I'm not going to get my kit off live on social media, but essentially I would switch the laser on, it will beep, okay? And essentially the laser's on. So you'll probably see white here. I would have this directly on the tissue. And what I'd be doing, you'd be lying down and I would scan this all over, up and down on gastrocnemius soleus area. I'd go down into the heel. I'd also be scanning into the heel, but I'd also go right down into all the other tissues down here as well, scanning here. Now that would normally last usually about 4 minutes for this treatment protocol. I'd be here scanning all of that. And this machine will turn off itself. There's no heat with this. There's no pain. You will not feel anything at all. The technology from the company that has got the patent on this, essentially you're getting a class 4 laser through this, so that's a lot of power going through this, a lot of joules going through this, but without damaging the tissue. Okay, so you're not going to feel anything. There's no pain, there's no discomfort, there's no big massive heat. It won't really go above 42 degrees. So you might feel a slight heat off it, just warmth, but that would be it. So essentially we'd start by scanning, so that would be the first stage of this. That, as I said, I've turned that off now, as I said, that would normally last about 4 minutes for that, and when I'm scanning I would do the whole calf area, and I would also go down into the plantar aspect of the foot. So that would be the scanning phase of that. I would then go on and do the actual pathology, and that would be probably doing, it would be the plantar fasciitis, or I would set the settings based on your presentation. So if it was something a bit more chronic, something a bit more needing a bit more power, then I would set that as appropriate. So on the pathology stage, after I've done the scanning, what I then do with this is I go on to particular points, usually around where the points of pain is. So this is the pathology setting. So there's more power going through this, more wattage going through this, to stimulate that cell response. So I would initially start on the tuberosity of the calcaneus. So I would go here, you can see I'm right on this. And essentially, usually about, I think it's about 20 seconds, somewhere around that here. But the machine again will switch off when I'm ready to move on to the next point. And then all I would do from here is go round those pain points. And in this setting for plantar fasciopathy, there's usually about 6. This would normally take about 6 minutes, somewhere around that kind of 5 to 6 minutes for this protocol here. From there, depending on the intensity of your pain, so I would do all these settings, so we'll let that just beep and kind of show you what happens. After this, what I would then do is then move on to one of the other pain points. So we're on 12 seconds, 11 seconds, and I'm not feeling anything here. And what I will usually always do, I should say, I would usually, when I'm doing stuff like this, I would have some active movement. So we would be taking you through some plantar flexion, dorsiflexion as we go through this. And I would probably do that through the scanning phase as well. We would have some, maybe, you seen how that went off, I would then move on to the next area, and there would be 6 areas on that usually. Depends, every patient's slightly different, so there isn't this, that's absolutely what I do. There might be some adaptations to that depending on your needs. Usually after that, if this is still feeling quite tender on palpation, that heel, I would usually then do some trigger point settings with the laser after that. So from here, I would go into the trigger point setting. So trigger points are bands of fibrous tissue. They're absolute wee buggers. And if you imagine like really, really tender spots in your tissue, and when you press on them, you just want to say bad words at me. So I can directly treat this with the laser. Now, in the past, prior to having the laser, I would do that. I would treat your trigger points with pressure, which is really, really sore. But effective, it's still really effective, but you probably won't say bad things to me when I'm doing it because it isn't nice. Another thing that I would do is dry needling, or medical acupuncture might be more recognisable to some of you, but essentially I would stick needles into it, get that twitch response from it and desensitise that area. Or we can do really painless, put the laser on it, it's about 20 seconds at a low output, and that's a really, really good result. So essentially, I would do some trigger points, usually for plantar fasciopathy, around the tibialis posterior, so that inner aspect of your leg. So this muscle coming down here, that kind of comes down here and comes and attaches down here. And if you think about this, this is where most of you will be getting most of your heel pain, in this area. So I'll usually go in with the laser and get a trigger point, usually just right in there, and tackle that. I'll then usually do some points around here to desensitize this area as well, and getting some quite nice results from that, from patients as well around the UK and Europe. So that, I mean, it's really not that invasive, it's not sore, but in terms of treatment, generally for me in here in the clinic, we can do standalone laser, right? But generally what you would do, so say for example, you've got some chronic lower back pain going on, maybe you've got some knee pain, right? You've got pain, back, shoulders, elbow, tennis elbow, golfer's elbow, these kind of things. It's absolutely phenomenal for wound healing. If you have any relatives that have type 2 diabetes that are struggling with chronic wounds, you need to give them my number. So things like that really can massively make a big difference to the healing and the time and getting those, basically when you're wanting something to heal, right, it's not like I have it's a magic wand that's going to magically heal it. But what it does is it creates the perfect environment in the body to allow the body to do what it needs to do. And essentially for wounds, that's what we're trying to do. We're trying to essentially create the best environment for the body to do what it needs to do, to heal. So essentially for this, what would generally happen is if you've got pathology, you're in pain, you've got something you need a hand with, then you would normally book a physical therapy assessment. And you would come in and you'd be assessed, and we'd do a thorough history of you. And I mean a thorough history from your full background to full medical history, physical assessment as well, where the pain is, and really just what's going on and why you're getting this pain outcome. And only if laser was indicated would that then be maybe part of your treatment, or maybe it would be a standalone treatment. I can't tell you just now sitting here saying that definitely would be indicated or that definitely would be the thing that was needed. It would depend. We also have, you can probably see in the distance here, the shockwave machine. And I'll do another video on that another day demonstrating that bit and what that would be indicated for. But you're unique and your life is unique, your physicalities are unique, and what you need is different to what your next door neighbour needs that might have a similar sore knee. Her knee is not the same as your knee, and your needs are different. So there isn't this is what I would do for you, but that assessment, that initial assessment is the most important thing. Now, your initial assessment in here, physical therapy, first assessment is £65. It's a thorough assessment. And then from there, you would then go on to a treatment protocol based on what you need. So that may well be laser. And if it is laser, and that's all we were indicating, then you would usually need about 6 treatments. And I'm saying usually because it depends on what it is. And that's usually where we would go with that. Now, each cost of that just depends. We would usually sell that in a package, and you would come in and you would have a package of the number of sessions that you need for the pathology, for the issue that you're needing. But I suppose just to get that out there, that it's not ridiculously expensive. You know, you're not talking a ridiculous cost. And I think that it's always nice to be transparent with that. So you're not like, oh my God, how much is this going to be? It's not ridiculous. Yeah, it's not going to be sort of free. There's cost associated to it, but that isn't a crazy amount, is what I'm trying to say. But in terms of if you are struggling with pain, right? So I just want to get that across. If you're struggling with pain and you would like an assessment, then please don't hesitate to get in touch. Your initial assessment would to be booking a new client or a new assessment, physical therapy assessment, and that would get you assessed, and then from there we would then be able to best help you. If you were just getting a standalone laser treatment, depending on what it is, but you're roughly looking about, if it's only the laser you're getting, and it's say for example it's just a one treatment area, then you're looking about, for each session, that would be about £25, usually for a 10 to 15 minute session. Okay, if you're needing more areas dealt with and you needed the laser used in conjunction with other things, then you'd be, your standard treatment is for 45 minutes is £50. So if you needed more things done, then you'd go into a standard treatment. But for example, what you might find is that you come in for a standard treatment and you're maybe getting a standard treatment, I don't know, once a month, say. And then if you're needing laser therapy, you'd have a little package of laser therapy that you're possibly getting weekly that's £25. So you can see how it's not as crazily expensive as maybe you're initially thinking. And the time of it, again, it depends on what you're needing. So if you were needing just plantar fasciopathy, and we'd done the main kind of treatment protocols, you're probably looking about a 15-minute appointment for that. So once you had done that, we'd then move you into a weekly appointment of 15 minutes that would be £25 for laser. But that would be weekly for about 6 weeks. It depends on how chronic your plantar fasciopathy is. But we would, within that, we'd probably need to see you monthly for a longer appointment to review, do some more tissue work around the area, reassess your rehabilitation, your exercises that would be part of your first appointment, and take it from there. So you can see how it's not ridiculously expensive, and it's almost like we're hitting, the way that my trainer taught it to me, like what we're kind of doing, it's like we're pushing that recovery along. And he described it to me as like, it's like pushing somebody on a swing. So you give them that big push at the start, so they give you the big push at the start, But if we then walk away and leave you, that swing, that recovery will gradually stop. And what we are doing is we're coming and we're giving you that big push again to then get that recovery stimulated again. But also mentoring you through your rehabilitation, because your eccentric loading will definitely be part of that. Coaching, mentoring, reassurance, all of that patient education that's vital to keep you reassured that what you're doing is working and that you're on the right path. For most people, that's the biggest hurdle, is they think, oh, it's not working, or is this right? So that's it. A little introduction to what the MLS Multiwave Locked grade 4 medical laser is, some indications on some of the treatments that we can do in it. But essentially, shoulder, elbow, wrist, hip, knee, lower limb, back, neck, ankle and foot. Inflammation, chronic pain, acute pain, so if you've had an injury and you've got a lot of edema as well, we can help with that. And also, which I'm absolutely loving, is the wounds care office, a podiatrist. Somebody always goes to the same time, but as a podiatrist, for some of the results that we're seeing and some of the research that's coming out on the wounds is phenomenal. And actually, I should mention here, like even just talking about inflammation, this laser, they're doing a study in the States on COVID patients who are in intensive care on reducing the pleura inflammation, so their lung inflammation, their inflammation in the lungs, and they're using this exact laser. They've got like a bigger head, and the patients are getting, they're under the laser, each lung 14 minutes per day, so 28 minutes every day for 4 days, I'm sure it is. And yeah, so that's a big study that's happening right now in the States using this exact laser for the reduction of the pleura inflammation of the lungs in COVID patients who are in intensive care. Right, so it's pretty cutting edge, pretty phenomenal. It's exciting. I'm excited to offer this as an additional. Now, I should say, for those of you so if you're coming in and you're getting treatment and you're in for a full treatment, you don't pay extra for your laser on that treatment. So if you need laser for something and it's indicated, that's part of your treatment. Is the same with our shockwave. We don't charge you any more for that. But if you're only needing laser, so if you've got a particular thing and you've come in, you've got assessed, then we can put you on a protocol where you're coming in and only getting that, and it's usually a shorter duration period of time. So I hope that excites you, excites us here in Glasgow. Maybe we don't get out much, but please, if you have any questions, don't hesitate to ask. If you want to book in for an assessment, you would definitely need an assessment first. I'll put the link up with this in here, and you can get a link straight to the diary and get booked in. Any postural dysfunction, essentially pains, trigger points, neck pain, shoulder pain, back pain, knee pain, just hit us up, let us know, and if we can help, we will certainly assess and let us know. If we can, we will more than happily refer you on and give you guidance of where to go next if we are not the right fit. All right, I'll speak to you later. Thanks for tuning in and have a fantastic Tuesday.